Chelsea, Connor, Carl, Clark, Debbie, Griswold, and Capone. So they're over my shoulder. If you see me on camera, they're two. They're right there. So in case you need to be graced with their presence, there they are. So, okay. You know, and we talk about mobility a lot in veterinary medicine, okay? Mobility is everything, especially as our pets get older. It gives them their independence, it gives them their freedom. And as an owner of dachshunds, and I'll mention this again in a moment, but you know, they are prone to something called intervertebral disc disease, IVDD. And so one of the things that I always want to make sure that they have are strollers. And because not some of these guys are so little, that you don't want to overdo it for them, especially in the heat that we're experiencing, for example. So I'm a big fan of strollers. I don't care, judge me all you want, but this is how we roll with my queen, ween, and my pack. I don't care, you know. So I have a double wide stroller, by the way. That's off of Amazon. If you're ever interested, it's a really good one. Hit me up if you're interested in learning more about strollers, because it's important to have a good one. Okay, so let's ask the audience this question. So there is often a disconnect between pain perception from your veterinarian and you, the pet parent. So, you know, do you agree or disagree with that? Now, when I ask literally the same exact question when I talk to my colleagues about that, and every single one raises their hand, because there seems to be a little bit of a disconnect, because sometimes we think that age is a disease. That's just part of the way it is. They're supposed to be like that. And that's okay that they're limping. They've been doing that for quite some time. No, I mean, we now in 2023, and I'm going to stress this year a lot, because this is a year where a lot of great modalities have come out there, my friends. And if your veterinarian is not talking about it, now here's a great opportunity for you to discuss them with your veterinarian, because we're going to share some modalities with them. So why is that happening? Well, oftentimes pain is perceived as a behavioral issue too. How many, if you think back to your animals, when you think that, you know, maybe that's just the way they're looking. So if you own cats, for instance, and you see them having a hard time going in and out of the litter box, for instance, this dog's gait that you see right here is very abnormal. We're going to look at that in a second. But that dog has a very abnormal, and if you're looking, he's not bearing much weight on the left hind limb there that you see there. And the owner will say, that's normal. That's not normal. Pacing, decreasing playtime, limping, inappetence, restlessness. You know, sometimes they'll think that that's just, oh, they're just getting old, that's just behavioral issues, or they're slowing down in their appetite because that's what it's supposed to be like. No, it's actually not. And if they are slowing down, it may not necessarily be pain, but there could be other underlying causes, such as like kidney problems. There could be liver issues. The list goes on, infection, you know, tick-borne diseases, a whole bunch of things that can happen. So I'm going to play and show you some pictures, and you're going to tell me if you think that this pet is in pain, okay? So what do you think? Yes or no? I don't know if the chat box is utilized and whatnot, but you could just shout it out to yourself. Yes or no? Do you think that this cat is in pain, or is it behavioral, or is it both? Okay. Now here's the answer. You're all probably right. Because welcome to veterinary medicine, where our patients do not tell us these things. And that's why we lean on you so much, pet parents, to get a vital history. Maybe this dog just experienced a thunderstorm that just came by, or fireworks were just going by, right? And so notice that this dog does not look happy. You probably would agree with me on that the ears are tilted to the right. There's a little bit of worrisome and concern. This dog's laying on his or her blankets too, just a little bit more hunched in. But also this dog could be in pain. Maybe there's an underlying ear infection. Maybe we have some arthritis going on. And the reason why I share this picture with you is because it is so important, again, to recognize and identify the history, okay? So when you go to your veterinarian and they're going to ask you any vomiting, diarrhea, coughing, sneezing, changes in the behavior, tell me more about that. They may give you or lead you in with some more open-ended questions, because we really need that history going on with that, what's going on with your pet. Okay, let's take a look at this cat. So first of all, how stinking cute is this cat, right? I mean, so stinking cute. I want to smush up the face and boop the nose. But do you think this cat is in any pain? The answer is absolutely not. So this cat is inquisitive. We're going to talk about what's something called the Grimace skill, but look at the whiskers. We're going to go back to whisker marking in a second for my cat parents out there, because look how nice and flaccid and relaxed they are. That's a huge thing. This is a young kitten, but this kitten's ears are pointed towards you, towards the camera, like, what's going on? What are we going to do now? What kind of mischief can I get into? What about this dog? What do you think is going on here? And I'm showing these pictures with you because of situations. Do you think this dog has pain, fear, anxiety, stress, all the above? And I probably would agree with you again if there's something obviously that is up with this dog. It's not normal for a dog to be hiding under a bed. So maybe there is illness going on. Maybe they're hurting. Maybe they're recovering from surgery. We don't know that they're still in pain. Or again, loud noises, fear, anxiety, stress. It's a big thing that's going on. And the reason why we're talking about this now is because I'm peeling back the curtain to what your veterinarian is trying to understand and decipher. Does this cat experience pain and behavioral issues too? And this is something that is so crucial that we're talking about now in 2023. And I'm so excited that we are sharing about this, because we usually just kind of put these things under the carpet and just address one thing. But we're talking about a multimodal approach. And so with the multimodal issues going on, we're going to talk about multimodal therapies at the same time. So keep that on your radar as we're progressing, as we're chatting. Okay, look at this sad little cat, this poor cat. Another good reason, this cat got attacked by a porcupine and had some like quills like left over or whatnot, ran through a bush. Another good reason, hopefully we keep most of our cats indoors. There's reasons for cats to be outdoors, of course, boring cats and so forth. But this poor cat definitely is not having his best day. Look at the ears, look at the whiskers. The whiskers are actually up a little bit and they're not as flaccid that they were with the cute little cat. So these are subtle things that we can look for when we're looking at understanding pain. Now, I would say that this cat has more pain than anything of like, say, fear, anxiety, and stress. Right. So, again, good things to recognize. How many of you said this to your doctor, to your veterinarian, I should say, or maybe have thought about this? Doc, she's still eating and drinking just fine. I'm so glad she's comfortable and not in any pain. She's just getting old. She's just getting old. Now, one of my favorite out of all the life stages that we have in VetNet, my favorite life stage of helping animals is the geriatrics. I love the whisker, the gray muzzle dogs, or the frosted faces, however you want to call it. But when they say that to me, it makes me scratch my temple and say, huh? What do you mean? Because as you and I are getting older, if that was just saying like, oh, Adam's just getting old, like, huh? Like, we still got our wits about ourselves. Like maybe some of us and some dogs and cats will experience cognitive decline, but there's things that we can do to really help go about it. And what is the number one thing that you and I need to do, as well as our pets? We need to start with a physical exam. The most expensive item in veterinary medicine is me. Hi, it's your veterinarian. Because we've gone to school to really learn about the physical exam, to touch, to listen. And I never want to discredit the power of a physical exam. So when your veterinarian says you need to bring him or her in, it's like, oh gosh, they're trying to price gouge me here. Oh, like we need to recheck the thyroid level, the phenobarbital level. Well, it's all because we want to do what's right for your pet. We understand that things can get expensive. But the most important thing, that if you take one thing out of this talk right now today, my friends, is the power of a physical exam, okay? Do not just say, oh my gosh, he just like grazed over my dog for 15 minutes and now I have to pay X amount of dollars for this. No, I mean, we're seasoned. Some of us know what we're doing. We're really honing in on certain aspects based on the history. So some of the things that we're gonna look at, gait analysis. So when we talk about gait, we're talking about like how they're walking, how the cat's walking. One thing that we taught our clients when we were curbside too, is we were watching these dogs come in. And so if they're coming in from curbside or just coming into your exam room or to your hospital now, look at them. And I love to educate our team to say, hey, what do you think is going on with this dog? Is it neurologic? Is it orthopedic? Is it both? And like we just mentioned, is it behavioral too? So, cats are a little bit difficult because most likely they're in the carrier or whatnot. They should be in their carrier, but certain things to look for nail wear on your dogs. And so when you flip your dogs and you're looking at their paws and you're flipping them up, you're looking at the top surfaces of their nails. And if there's any scratch marks on there, like from doing this, when they're like going on hard surfaces like concrete or pavement, that's when you kind of know that there might be some nail wear associated with it. So that's letting me know that they're not distributing forces collectively on all those 4 limbs. There's a little bit of, they're compensating for it. So a slow walk, we talk about that. Difficulties doing number 1, number 2. You may not realize how many muscles are involved with a male dog lifting his leg. How many muscles are involved with a female dog squatting and a male dog squatting to do number 2? A lot goes into it. So if you see them doing that shuffle, like hold on, hold on, hold on, hold on, and okay, I'm good. But like maybe they're like limping or leaning a little bit. Same thing with our cats. You see them in the litter box, and they may not even jump in the litter box, because that's where I tell my cat parents is like, you should have no lip. They should be able to walk in, especially for our senior dogs and our senior cats going in. So difficulties doing number 1, number 2. Those are really vital, crucial moments of observation. Okay, this is a really good thing. If you want to get a screenshot of this or a picture, go for it, because we talk a lot about this on the human side, but there's 3 types of pains that pets experience. Okay, and it's divided into 3: somatic, visceral, and neuropathic. So let's talk about this for a second. So the somatic pain, so that's the one that we tend to think of the most, that you and I would know. Limbs and skin is what I tell my pet parents. So if you see them limping, if you see cuts, bite wounds, those hurt. Those are somatic pains. Those are things that are pretty visual to you and I as pet parents. And we want to get those rectified relatively quickly, because we don't want to see them in pain. Then there are things that are more hidden underneath the surface. So I want to direct your attention to neuropathic pain, nerves and spinal cord. Think of like slipping a disc when they're having a hard time. Maybe they're dragging their feet, and you're seeing that nail wear. Say that 5 times fast. Nerves and spinal cord. Think about dental pain. That could be neuropathic pain too. So maybe you don't think that they're having dental issues, but you go ahead, you get the dental cleaning done. And I hear this all the time, by the way, when we have to take out some teeth. The pet owner will be like, oh my God, thank you for giving me my dog back. He's running around and eating like a puppy again, because you didn't realize that that's neuropathic pain that they're experiencing. The third and the last one is visceral pain. Those are the internal organs. So when we're doing abdominal palpation, maybe they're like, oh, that hurts. These are some things that you may not notice that they're having. So think of like a belly ache, for instance. That could be an example of visceral pain. So if a dog got into something, a foreign body, for instance, sometimes they'll be wagging like, hey, what's going on? Everything's going fine. But then you go in and you start palpating the abdomen, and they let out a huge yelp because that's where it hurts. That's visceral pain. So those are 3 types of pains that pets experience. And this is across the gamut for all species, dogs, cats, even us humans too. So keep that on your radar. So I'm going to show you a picture next, and you're going to let me know where you think that this dog has experienced pain. Is it somatic? Is it visceral? Or is it neuropathic? So this is a dachshund. Of course, I'm a dachshaholic, so this is something that I see, unfortunately, too often in practice, because I tend to see a lot of overrepresentation. So this dog is having her back is arched, okay? A couple of things I want to draw your attention to when you see a dog in pain. Tail tucked under those legs. So that is a really good example of pain, but also remember, is a behavioral too. But in this situation, when you're seeing the ears cocked back, the eyes just kind of not disengaging with you, that is a good example of neuropathic pain. So we just talked about those 3, okay? So neuropathic pain. This dog has intervertebral disc disease, a slip disc, and it's usually right where the arrow is, T12, T13. So big issue that we see there. Now, the one that I just showed earlier, when I'm talking about, look, this is an interesting scenario, because this dog definitely has pain, but not so much where it's like acting like a lunatic chasing the birds around, right? So pet parent thinks everything's fine, but of course, leave it to me to notice problems, because that's what we do as veterinarians. We're scientists, so we see these things. So this dog is orthopedic in both legs, both the thoracic and the back left leg. So this dog looks like she tore her cranial cruciate ligament. She's not bearing any weight on that left hind leg. Then there's also something going on in the left shoulder of this dog too. So again, so that would be classified as more somatic pain, limbs and skin. Okay. And then we take a look at this one. this cat, as we know, is hidden. And just to give you some context, this cat was not eating for several days. Everything else was fine, normal gait, everything on physical exam, but then you go ahead and you palpate the abdomen, and this cat wanted to like maul you, generally very sweet cat. So going back to our 3, this is visceral pain. This cat was obstructed. This cat ate way too much string, which is very common in cats, so needed surgery. So when you think of your own kind of pain that you have on, and we are fortunate enough where we can actually describe it to our doctor. Doc, it hurts when I do this. It hurts when I flex the shoulder like she's doing right there. So maybe she's got a rotator cuff injury. But with us, it's just a good reminder, again, how important it is to do a thorough physical exam. Because I know this may seem very juvenile to all of us on this call, but I'm not kidding. The physical exam is so, so important, because I feel like as veterinarians, we are investigators. We're trying to identify or localize if there's any pain or discomfort that's going on. So again, we could say, hey, it hurts when I go like this. So maybe we have to make them a little uncomfortable for our dogs and cats to do a physical exam, to flex the shoulder, for them to go around a little bit, so we know that that's where it hurts. Okay. Now, so what's new? Dr. Christman, you're just talking about 2023 being a year of cool stuff. Take a look at this. So have you guys heard of the ability that you can actually monitor and record your pet's pain? So this is something called Pain Trace that's around. It's been around for about a year or two. And this is something that you and I would work together on. We put some leads on your dog, on your cat, and we're going to look for inflections, okay? So like you see the pet parent looking right there, that negative spike, that spike down there that you're seeing, that's a deflection of pain. So maybe we're doing a physical exam, we're noticing that, like for this example, that there's some back pain that's associated with it. So this gives us a really good opportunity for you and I to work together in identifying pain together, which is great. So it kind of goes up against the connotation of my dog's just getting old, quote. Well, let's do a physical exam, throw these leads on, Pain Trace, and let's see what we got going on. Maybe we need to talk about doing some shockwave therapy or using the Assisi Loop, because we're noticing that there is some pain elicited to the back legs, just as an example. Okay, what else we got? Okay, so this is amazing. So, many of us, probably all of us, have had our temperature screen now that the plague has been here before, so we know what this is like. Now, this is something called Therm, and this is a good way of looking at inflammation. So when we're looking at redness on our dogs and cats, this is a tool that we can use in conjunction with the physical exam. Remember, I'm bringing it back to that physical exam, but they can scan your dog, scan your cat, and they can see if there's any redness associated with things. So maybe there's the gums are super inflamed. Maybe we're looking at those hip joints that are really hot. So that gives us an idea where we need to focus our attention on. Okay, so keep that on your radar as well. So that's called Therm. So that's pretty cool that you can use that as another modality. So what are some signs of pain in dogs and cats? So this is a really great picture. If you want to get a picture of this and kind of file this away, because we're here to level up as pet parents. This is from our good friends at the Animal Medical Center in Manhattan. And so let's talk about ones in dogs. Decreased social interaction. Maybe they don't want to play or engage as much with you. Something's going on, right? So they're going to decrease that activity level because they're hurting. Increase sleeping, okay? Notice that those are the first two ones that you're noticing that are up there. And when I see that, you're thinking, my gosh, that just sounds like an old dog to me. Well, again, our animals are living longer because we're able to identify and recognize signs such as pain earlier in their life, so we can do things more to help alleviate that. Anxious expression. Maybe it's not just those thunderstorms that came through. Maybe they're just anxious overall because they're hurting somewhere. Reluctance to move, whimpering, groaning, yelping, panting when resting. Now remember, these could be other signs associated with it. I'll give you an example. Hypothyroidism, for instance, could be something that can look like excessive panting. Lameness or limping, not going up or down stairs, lack of interest in food or play. Sudden behavioral changes, and this is where I lean on you for this. I really need your help when I ask you these questions. Have there been any sudden behavior changes? And you look back retrospectively and you're like, Yeah, for the past 2 months, she's been slowing down a little bit. Like ever since, I removed that tick off of her, for instance, like she's slowing down. So gives you a good example. Arched or hunched back, that's an example there. Excessive chewing, licking, or particular area of the body. Maybe it's not dermatologic. I'll stop for a second and insert dramatic pause right there. Maybe it isn't dermatologic. Maybe, just maybe, they're in pain. So Arden says, I've asked our doctor about pain trace. She made a call to one clinic in Illinois who no longer carries it. So she says the tech probably isn't there yet. So I bring it up again. I would. They're based out of Kansas City, Missouri, so not far from you, Arden. So I definitely would inquire about it. So thank you for your question. Hold on, I'm gonna have a drink of my lemonade. Fun fact. So there is this adorable girl named Delaney who's coming on to our show. So I have a talk show called DVM 360 Live. She's coming in 2 weeks, and she raised over $10,000 with her lemonade stand for dogs and cats in rescue. And I loved her story so much that I want to bring her in. And so our company today is doing a lemonade stand for her, and we're doing a company match. So whatever we donate, our company is going to match. And she doesn't know this, but we're going to present her with a check on the talk show that she can use to an animal shelter of her choice. How cute is that? Oh, and I love inspiring kids. So if you have children that are interested in vet med, keep that candle, that light going for them. Keep it lit, and I'm happy to inspire them by any means. So please, we need a lot of veterinary professionals in this profession. So thank you. Okay. All right. So moving back on, I can't get out of this. Okay, hold on. Let me close this. Let's talk about our cats. Hiding, reduced activity, changes in the litter box. All right, big thing, changes in the litter box. Lacking of agility or jumping, excessive licking and grooming. Again, let's pause for a second. Excessive licking and grooming in cats can certainly be associated with pain. So sometimes they're licking their front end, their front legs. I see this like almost classic, licking the front, but when they're having a urinary tract infection and it hurts back there. So file that away. Stops grooming, matted fur, nothing like a disheveled cat to let you know that something's up, right? Stiff posture of the gait, tail flickering, and not just a normal like wave back, it's flicking, something like annoying them. Loss of appetite, weight loss, changes in the facial expression. And we're going to talk about that in a second because I want you to identify this. So those are really good things. Now, here's something that you may or may not know. This is a little next level, but remember, we're leveling up as pet parents, right? That's what you came here to learn. So there is something called the Colorado State University's acute pain score. So what acute means is like a recent injury, it just happened a few days ago kind of a thing. And you may see posters. I don't know if they have these up in your clinics or your hospital when you bring your pets, but we scale them on a scale of 0 to 4 based on psychological and behavioral. So that's why I really emphasized earlier, just before, the importance of understanding behavior, because this is how we're going to pain score your dogs and cats. Okay. So a 0 is comfortable, happy, content. 4 is holy smokes, we got to get them on meds, stat, pain meds right away, IV catheter, holy smokes, something's going on. So that gives you an idea of like even from the colors that you see there too, from 1, 2, 3, and 4. Most of the animals that I see coming in based on a history, if they're like restless, not themselves, kind of what we call ADRs, they're usually between like a 2, 2.5, or 3. And so that's where we get them, addressed. But the emergencies that I'll see, the flat out ones, those are 4s, so kind of puts things into perspective. So this is called the Colorado CSU. You can learn more about it. You can Google it. You can print one out yourself. It's a great teaching tool for yourselves to learn more about. And the other one that I absolutely love that we use a lot in veterinary medicine is the Feline Grimace scale. And this is a relatively newer scale that has been from our friends in Canada and colleagues out there that have done a lot of research. So remember, I just showed you a couple of pictures of some beautiful cats, ones that were hiding and that really sweet cat that's like, what's up? Where's the party at? Well, look at the 0 that you see on the far left. Like this cat right here is like, where's the food and where's the party at? Yes, cat is like completely into you right there. So what does that mean? So this is a very subjective scale from 0, 1, and 2 to let us know how our cats are perceiving pain. Now, cats are notoriously well at masking signs of pain. Remember, it goes down to predatory feelings, and cats, more so than dogs, they don't want to be seen as prey. So they will hide their signs very, very well. So we do this Grimace scale to kind of get a idea of what's going on with their pain. So we're looking at ears, eyes, muzzles, and whiskers. So very simple things where you don't have to actually touch these cats to get an assessment. Now, this is a great tool when I do virtual consults, okay? Now, I don't know if you've experienced it or I did like a virtual consult with a veterinarian, but this is something where I would say, can you keep the phone on your cat for just a moment? I just want to take a look at them. And this is what I'm doing, is looking at the Grimace scale. I'm looking at their ears, so they should be facing forward. Their eyes should be nice and open. The muzzle is relaxed. The whiskers are loose and curved, okay? And the head's above the shoulder line too. The head's like up and cocked up a little bit. So that's a 0. That cat is just a perfect 1. Then you go to the 1, and so this cat looks to me uncomfortable. Something's going on. And how do I know? Look at the ears. They're slightly pulled apart. The eyes are partially open. Like, it almost hurts to have the eyes open. Muzzle is mildly tense there. And see those whiskers are slightly curved or straight. Take a good look and see the difference between 0 and 1. Do you see the difference? See how they're not as flaccid and relaxed on those whiskers versus the 1? And the head's aligned with the shoulder line a little bit, almost as if it's guarding itself a little bit. So to me, if I did a virtual consult and you wanted to know if you need to bring your cat in to be seen, that would tell me and trigger me to say, yes, your cat should be seen. And this might be something where I could say, like, if it's late at night, maybe wait until the morning kind of a thing. But when I see a number 2 on the far right, that cat needs to be seen ASAP. So this is a cat that has a urinary blockage, I can tell. This is like a classic look. It hurts these male cats so much. Look what the whiskers are doing from the image. See the difference between the whiskers here. I don't know if you can see my arrow, but they're curved more upward, straight and up, versus the ones that are flaccid. Eyes are closed, mouth is open. Look at the ears too, they're rotated outwards. So this is a Grimace scale. That cat's a 2, very painful. Let's get him on IV medications right away to stabilize him and take some of that pain away, okay? So very important. Now you may ask yourself, Dr. Christman, how do I know? Maybe you should take a survey. So here's a great one. This is from the University of Pennsylvania. All this information that I'm giving you on this call, my friends, this is high-level resources. This is great stuff. This is next level. This isn't Google. This is next level, right? That's what you're here to learn for. And so you won't find these things like given out, like you Google these things. These are things from peer-reviewed literature that I'm sharing with you, the pet parent. So the canineorthopedicindex.com, write that website down, to the University of Pennsylvania School of Veterinary Medicine, and you can take a survey yourself so you have an idea. Their vet hospitals now do this, and they cater this survey based upon the wants and needs of that practice. So this gives you an idea, like an index. And look how granular, in other words, look how specific these questions are. It's not like, is your dog limping? This is, how severe is your dog's stiffness after first wakening in the morning? Nothing like you and I when we're stiff in the morning and it hurts to get up. Same thing for them. Is it that difficulty to rise, to get up, for them to do number 1, number 2? Are they okay? How is it later in the day? How severe is your dog's stiffness after laying down for at least 15 minutes? So, really specific questions that you may not know. And what I like about this survey is it triggers your thinking about things you didn't realize, like, oh, I just thought that was like normal for her to do. Now you realize it's not, and now we can do something about it, okay? And then this does get into the questions of quality of life. This is a big thing too. Now let me stop for a second and talk to my pet parents out there, because I'm one of them. I wish our animals can live forever, but they don't. They're living, breathing creatures, okay? And we cannot set unrealistic expectations on our dogs or cats, okay? It's gonna happen. And it's part of the beautiful thing of owning an animal. It's the beauty behind the human-animal bond, is that we bring them into this earth, and hopefully we have the honor of letting them leave this earth with the dignity they rightfully deserve. Unfortunately, there's other issues that can happen, like hit by cars and trauma and all these different other instances that may happen. And that's unfortunate too. But again, we have a profession where we can let them leave this earth without and crossing over with dignity and comfort, right? We want them to be free from pain. So we are going to be asking you questions about quality of life, because who are we? Sometimes you may see, am I keeping my dog around more for me than for her? Maybe you are. Maybe you are. And maybe you need to take these survey questions to see if it is time. So again, They're not easy questions, but they're necessary questions. They're necessary questions. Another great website for my dog parents out there, from our friends out in the UK, my wonderful colleague, Dr. Hannah Capon, she has this great website called Canaan Arthritis. That's supposed to be just .co.uk. And a lot of great pet parent information is on there about arthritis, managing osteoarthritis, all those different things. It's a good website for you to check out. The other thing, I'm going to give myself a shameless plug, but I'm very proud of this book because it took me years to do, because, you know, maybe I only have 20 or 30 minutes of a consultation to talk to you about your dog's paralyzed, or your dog may be paralyzed, and this is how you squeeze the urinary bladder of your dog for rehabilitation. So I decided to co-author this book with a friend of mine, Kristen Bryant, and we wrote this book called Honey, Have You Squeezed the Dachshund? A guide for dachshund owners who are terrified of IBDD. IBDD stands for intervertebral disc disease or back disease. I mean, I have it so much, like, look at I don't know if you can see my video, but look at my little toy I have too. I even have a dachshund in a cart because I owned one for 12 years of having a paralyzed dachshund named Cosmo, who inspired me to write this book. So it's on Amazon. If you or you know somebody who needs to learn about rehabilitation, about these things, that it's okay for them to walk, to not walk, get the book, you know, because I do think it's important for them. Okay, so let's talk about integrated pain modalities as we're wrapping up here. So there's I love that in this day and age now, and I have a big smile across my face because I love that you, the pet parent, are asking about it. You're doing your research. You're hearing things like shockwave therapy, laser therapy, acupuncture, herbs. I love it because guess what? There's research and the evidence is showing that it is working. There's evidence behind it. Now, if you don't have a veterinarian, unfortunately, I will say there are veterinarians that may not believe in that, but the research and the data, I can tell you, I sit in continuing education full time. I sit in these lectures. It's there. So maybe find a veterinarian or an integrative practitioner that can work with you because it's so important. How many of you agree with this statement? I prefer a multimodal approach to pain management. And what that means, pet parents, is that maybe you have a dog that's on a non-steroidal anti-inflammatory. So maybe they're on some sort of medication, but maybe they're also going for acupuncture. Maybe they're getting laser therapy. So that's a multimodal approach because inflammation and pain, you have to hit it at different levels of the cascade. I wish I could say there's just one magic pill or modality that really is going to do it. And it may be for a couple of things I'm going to show you in a second, but for the most part, you need to do a couple of things. So I'm going to show you some things that that you may or may not know about. But when I go ahead and just Google, because I get asked this question every single day, and I don't mind, on my TikTok live stream. So if you don't know, I do daily TikTok live streams with pet parents. I've been doing it for over 3 years and I never missed a day. Vacation, I've taken you all with me on vacation. I've taken you with me when I've been sick, and I still go on and I help you guys out because that's how connected I am to the pet parent community. And when we talk about hip and joint supplement, if you just Google this is what you get. So my recommendation for you is to chat with your veterinarian. Follow the science, okay? Follow the science. There's a couple, I'm not gonna bash anyone on the call. It's not my intention, but there are ones that are there that I don't think do anything, you know? So you wanna make sure that the evidence is there and you follow the science and you follow the recommendations that your veterinarian would recommend, okay? Because it's important. I do want to touch upon something that I think is a really great modality called the Assisi Loop. Have you heard of this? Does anybody know, or do you experience the Assisi Loop for your dog or cat? If not, get this loop. I think it's a great one. And the reason why is because it's used from multiple different areas. We talked about behavior, we talked about pain, we talked about skin. Guess what? You can use the Assisi Loop on all three things that we just mentioned. And those are three huge things. So you may have a dog that's got separation anxiety, but also has a little bit of osteoarthritis and maybe has a lick granuloma. And guess what? You got something now that can work. And the control is with you. You can do these at the comfort of your own home. So this is not a prescription, but certainly always chat and consult with your veterinarian that you use, because I always like to know like what you're using at home, so that way we can add that into the regimen. And there is not going to be a veterinarian that's going to deny you, like, oh my gosh, that's like terrible. The Assisi Loop is the one that will work for what we're going to talk about in a second. So pain, inflammation, healing soft tissue and bones, decrease, eliminate need for pharmaceuticals and opioids. And like I said, it works well with other modalities. So when you see this loop, you don't have to put your dog or cat through this loop. You can rest it comfortably on them, on the area of concern. So maybe it's a hip, maybe it's a joint, hip joint, maybe it's the ears. I do like the Assisi Loop. Now it's called something, and I like to give you the science, so it's time to science up a little bit, but it's called targeted pulse electromagnetic field therapy. Now, this has been around many years on the human side, so that you might be familiar with, and it has been over on the veterinary side for a few years now too, but it delivers a little current. You don't feel it, they don't feel it, to trigger the animal's own natural anti-inflammatory process. So it's basically the loop is telling your body, hey, decrease that inflammation so I can feel better. And so you it has X amount of sessions to it, quite a few sessions. You can, if you're interested in purchasing it, assisianimalhealth.com is where it's at. And someone calculated out for me, I think it was like $1.03 or whatever per session, somewhere around there. So just to show you like how long and what your value is on using this. So for my dachshunds, I Assisi Loop them at bedtime. And I do think it makes Chelsea nice and sleepy and comfy, which is great. So please check out the Assisi Loop. I think it's one of those things. I think every dog and cat should have one of those things, because it's never, it doesn't expire. You can use it whenever you need it. It's one of those great things to have. They use it a lot in the dentistry side now. There's a smaller one. So like if we have cats that are going to have like full mouth extractions or even a dental ahead of time, we might recommend doing the loop beforehand, but then it's also going to be used afterwards. And you just put it next to their face. You don't have to have them, they're not chewing on it. It's just a smaller loop. So it helps with, like I said, preparation for surgery, and it reduces any swelling. So I like them a lot. They have a lot of clinical trials. There's data that's around there. Pet parents have been very creative with how they go about using it for the ear infections or brain lesions. Some pet parent taped this into the cone of shame, which I think is cool. I like that. And again, we talked about the orthopedic neurologic wound. So we talked about that. I know I get asked a lot about degenerative myelopathy. If you know, you know. It doesn't treat it. You know, I wish we had something out. They're coming out with stuff, hopefully some research there for DM, but you know, something's better than nothing is how I look at it too. So, you know, I'm sure everyone has one of these in their backyard. No, but I put this on your radar because you may not know that hyperbaric oxygen therapy is around on the veterinary side. It's not common, but larger hospitals, teaching hospitals carry this. And there's been a lot of studies that help show that it can help decrease, you know, wounds or increase healing time for wounds, helps with like snake bites, for instance. It just, you know, delivers oxygen to the therapy tissues that need it. The other thing that you might hear about is something called Synovitin. And this is, remember when I was talking about like multimodal approach? You may not need a multimodal approach. If you have a dog that has elbow disease or arthritis in the elbow, this is a one and done injection. One injection done in the elbow. The dog has to be sedated for it, and then they're good for a year. So pretty cool stuff. It's not available you have to check your state, because it's not, it varies on like who has it, because it's a radioactive isotope. So you have to have like licensing for it. But I do think that, and I'm on record for this, I do think this is one of the game changers in veterinary medicine is Synovitin OA. I think it's fantastic. Okay, last one before we wrap up is shockwave therapy. Now you tend to think of laser therapy. I think you tend to hear that more often, but I do want to mention shockwave therapy because it is a modality that's out there. Great studies and publications. I don't have them up, but I hid 8 slides when I talk about this to veterinarians about all the great studies that are shown about shockwave therapy. But it's used to treat many different things, such as hip and elbow dysplasia or osteoarthritis. You tend to think of it as like this is what you think shockwave therapy, but it's not related to an electrical shock. It's really a high energy sound pulse that's there. Okay, and it's targeted at a very specific area of tissues. And so, and how that works is that it affects high energy, and they go deep into the areas and the cells that need it, and they release certain things called growth factors, for instance. And the good thing behind it is that you don't need many minutes behind it. So you're looking at maybe 3 to 5 minutes of a session, and less sessions too. So it's more cost effective to you as a pet parent. So this is one called Pulse Vet, and this is something that's like transportable. So if we were to do house calls, for instance, like we can come to your house, we don't need to wear personal protective equipment for that either. So So pretty cool stuff. Let me show you a video of it so you have an idea of what this looks like. This is Dr. Jennifer Bertucci. Shout out to Dr. Bertucci using it. Like, I mean, the cat's like chillaxing over there, right? Here's another one. So the sound is something that you is probably newer to you when you hear that. You're like, oh my gosh, it's like no, I haven't seen a dog or a cat freak out from it. Like you can prep the sound for it, but they don't freak out as much as you think they may have. So I do think it's something to talk to your veterinarian about. Shockwave therapy, acupuncture. Have you gone for acupuncture? Have you gone for acupuncture? But have your dogs or cats gone for acupuncture? I think it's fantastic. It's a great way to integrate post-op pain management. They use it now to treat like inflammatory bowel disease in dogs. So a whole bunch of things that are out there. So in summary, there's a lot of new tools that we just talked about identifying pain in our patients. So I want us to use them. There's incredibly innovative modalities that are available for pain management. We just talked about them. Maybe you didn't know about shockwave therapy, or you didn't know about Synovitin, for instance, or Assisi Loop. Use them or talk to your vet about them. Pain protocols with traditional Eastern medicine, that's my jam. I think finding that nice sweet spot in between both modalities is fantastic. Pet owners, you want non-invasive ways. You want maybe to not have them on necessarily what's called a drug per se. So, let's give it a shot and try. And the science and the evidence is there. It's not like this is made up. And so, if we can offer safe and sedation-free treatment for many difficult cases, it helps our hospital to say, hey, this is what we have to offer versus other hospitals down the road of your veterinarian. Like, they genuinely are showing care and concern by enveloping and embracing all these different modalities into their clinics. So I think that's a home run. And if you want to learn more about me and what we do at work too, you can, and this is a free website, dvm360.com. It is catered towards the veterinary professional, but there's some great content in there that you're going to love. And it's nice to know like things like, I didn't know that mental health is huge in veterinary medicine. I had no idea what you're going through. So it's nice to have that. We do have conferences for continuing education, and that's what I curate for a full-time job. I do have a talk show that you would love. It's right there at dvm360.com called DVM360 Live. It's a fun show, half hour, of us highlighting all the great things that veterinary professionals do in and out of the exam room, which is great. But you can catch me also on Fox. I'm going to be an affiliate for Fox Weather on TV. And so we're going to be doing a whole segment. I'm going to be not live. We're filming tomorrow, but we're going to be filming an episode on like heat stroke and allergies and pets and pain. So lots of great things to catch me there. So here's all my socials. Is that a thing? Do I call it socials? Do I tell me that you're old without time? Oh, somebody said you're old because I said, oh, here's my username. Oh, no. I said, here's my handle. Here's my Instagram handle. Like, oh, you're old. I'm like, shoot. But anyway, here are my handles. So I have dvm360.com. Of course, you can check me out. I have my website too, dradamchrisman.com. And of course, the Facebook, Instagram, TikTok. If you ain't on TikTok, follow me. That's where the party's at. YouTube, and of course, LinkedIn.